In this pandemic, they've been opening our eyes
We've got over 16 patients now in intensive care.
to the reality they face,
I feel like sometimes I'm in a war zone.
sating our hunger for information,
The death rates are worse this time.
our need at times for reassurance.
We'll hold your hand, we'll be there.
Yet for some, once wrapped in our now distant applause, another unpleasant reality is taking its toll.
I've been called a racist, I've been called a shill of the government, I've been called a eugenicist, actually.
I've been called a devil, Satan, a prostitute for Big Pharma.
The main one for me is liar. And that's probably the one that hurts the most, actually.
For Claire Davis, an A&E consultant from Cardiff, it began with a tweet on December the 8th. Absolutely stoked to be one of the first in the world to get the vaccine, she wrote, adding, "2 fingers up to the deniers and the conspiracy theorists. Science wins." Born out of frustration, she says, and exhaustion.
Before I knew it, it was being retweeted again and again.
Soon it had more than 1 million engagements, initially supportive.
But as it went further and further, it was just attracting this level of venom that I've never ever experienced on social media, and it made me feel very, very vulnerable.
The vitriol directed at this 33-year-old who's worked for the NHS since she was 16 poured in.
Fake and staged. You'll be a drooling cabbage in 6 months.
You're now fully owned by the elite.
Looks like she's a paid COVIDiot.
Nazi propaganda pusher.
Poor bitch. Non-human.
Just a sterile slave.
Big Pharma prostitute.
There were repeated claims the vaccine would leave her infertile, even though the NHS says there's no evidence to suggest the COVID vaccines will affect fertility.
I think this sort of themes, they're quite exclusive to being a female. I haven't seen males get that response. People saying that I'm almost certainly dead by now because I've been vaccinated. People just repeatedly questioning why I'm lying. I'm a liar, always, why are you lying? And it all just chips away at your resilience. And it really is, the last thing that we need.
Matt Morgan, an ICU consultant from Cardiff, screenshots, comments accusing him of being crooked, telling lie after lie, asking how much he's paid to mention vaccines. Others call him media filth, a shill, and after discussing end-of-life care and the elderly, he was told, "Shut up, you eugenics-loving fascist POS." POS?
Yeah, I've been called a piece of shit. There's more I've deleted. Colleagues of mine across intensive care in South Wales have been sent death threats or threats of physical violence.
Death threats?
Death threats, yeah.
Claire Davis says some boasted of monitoring her on different accounts after she'd blocked them on Twitter.
You start to think, what if this translates to the real world and someone walks into my department and starts up along this line? And yes, it was frightening, I must say. It was really frightening.
Amy Jones previously served in Afghanistan as an army medic. Her updates from critical care have drawn repeated abuse and accusations that she's lying.
How much was she paid?
Absolute lies.
They're lying. The hospitals are empty.
We know it's lies.
Sold her soul for the dictatorship.
Keep the propaganda coming.
They're lying.
All lies.
She was probably paid to say all that.
So busy, but finds the time to talk on camera.
They range from kind of personal insults, commenting on your appearance or your tone of your voice, right through to quite kind of vicious things that I should be struck off. Someone's going to round me up and put me in prison or hurt me. My nurses were absolutely devastated by it. Not particularly because I'd been personally attacked, although they didn't like that. They said people think we're lying. People think I'm coming to work and lying about what I do. They couldn't believe that they're breaking their back and, killing themselves to try and keep these patients going, and that people are turning around and saying that we're lying and none of that's happening and that COVID doesn't exist.
A lot of people who may not have had so much focus on them have been astonished by the level of hate that's been targeted towards them.
But even if you're wearing the proper tight-fitting PPE mask.
Farbod Babol Hovayaji is an A&E doctor. We filmed him in Cardiff last March in PPE training.
All right. demonstrate that.
Rebutting claims that COVID didn't cause deaths and hospitals are empty is, he says,
well, it's exhausting. It's exhausting. Psychologically, it's exhausting.
Of course, people will say, if you don't want grief on social media, don't go on social media.
I mean, that's fair, but I think we also have a responsibility as healthcare workers and healthcare professionals to kind of counteract a lot of this.
I've been asked by friends, why don't you delete your account? But actually, I have actually found quite a large amount of resilience through social media through this, because it's an easy way to share your collective experience with people all over the country that are in your position. So it's not all bad, social media, at all. And I think it's just finding a balance between the resilience it offers and then this quite dark side.
There are others experiencing this. One health board told me the issue is so sensitive they didn't want to put anyone up to discuss it openly. Staff are really struggling, I was told. Another doctor who's received online abuse tells me there's a lot of people running on fumes. It just takes a push in the wrong direction and someone could get very badly hurt. In Cardiff, the artist Nathan Wyburn stamps words of abuse into the contours of a bruised health worker's face. Words supplied by Matt Morgan. It's been commissioned by the Wales Millennium Centre and local health board. Like the artist, who has close friends in the NHS, they want this issue discussed more.
It does make me really angry, yeah. They saw their friends suffer, they saw their friends ill, they saw their friends die, and to then go home and to get this abuse online as well, I can't imagine what it does to them.
I guess the times it gets to me is more through my family or my colleagues. You know, I've got 2 daughters, and one of them asked me, "Dad, what's a eugenicist?" You know, I don't want to be explaining that to them.
I think what's been quite remarkable is how the narrative has changed. Whereas instead now of being heroes and being clapped, and we are now being told that we are killers, we are liars, we are frauds.
If we agree that most of this is ill-informed, malevolent commentary from some very unhappy people, why does it matter?
I think it matters because these views are becoming more widespread.
For Claire Davis and colleagues, it taps into fears that what begins online can soon end in COVID wards even, or in the case of England's chief medical officer, the lunch queue.
He's a liar, you're a liar.
So their message to social media companies, do more about abuse, and to their critics, it's not sympathy they want.
Liar!
Just want to be treated with civility and treated as people that are doing our job daily under pressure, and not to be called murderers or prostitutes or, you know, slaves to the system or devil worshippers or whatever else that they've thrown at us. We don't want to be called heroes. We just don't want to be called that.
In years to come, no doubt, the story of our pandemic response will be framed in the colours of early effusive gratitude to the NHS. But how well we protected the well-being of its staff thereafter may offer a less flattering reflection.
And Andy joins me now from Cardiff. Andy, it's a really heartbreaking report, that. So what do the social media companies have to say for themselves?
Well, against a backdrop of ever louder calls for them to be much tougher on this sort of thing, we've had a couple of statements. Facebook have told us they're reviewing all of the comments we sent them regarding Dr. Amy Jones, and they've already taken down some of that content which violates their policies. They said that between March and October last year, they removed 12 million pieces of harmful COVID misinformation. Similarly, from Twitter, a statement saying that abuse and harassment isn't acceptable on their service and that they have policies to address hateful content and threats of violence. They've asked us to send them specific links to some of those tweets to review, and we'll be doing that. But I suppose there's a broader point here, isn't there? And that's about the psychological impact all of this can have on nurses, doctors and other healthcare workers, seeing those comments saying hospitals are empty, patients aren't really dying of COVID, seeing protests outside hospitals. And for them at a time, for the NHS at a time when retention of staff is such a challenge, there are real concerns that something as insidious as this could prove the last straw for some of those who are completely burned out and possibly pondering their futures in the NHS.